Meningitis is a word that can cause a lot of worry for parents, and understandably so. It brings with it a sense of urgency and concern, as any potential threat to our children's health often does. But understanding it can help you feel prepared, not scared. Knowledge is power, especially when it comes to protecting your loved ones. My goal is to give you clear, simple information so you know what to look for and what to do. We'll break down the complexities and provide you with actionable steps. Meningitis happens when the protective layers around the brain and spinal cord, called the meninges, become swollen, usually from an infection. This inflammation can be triggered by various pathogens, including bacteria and viruses. This swelling is serious because it puts pressure on the brain and spinal cord, potentially disrupting normal function. While meningitis is rare, it can develop quickly and have serious consequences, demanding prompt medical attention, so knowing the signs is vital. Early detection can significantly improve outcomes. Most children with fevers or rashes do not have meningitis. It's important to remember that these symptoms are common and often related to other, less serious illnesses. But being aware of the symptoms can make all the difference. Vigilance and awareness are key. Early diagnosis and treatment mean many children recover fully, returning to their normal, healthy lives. Your role as a parent is to notice when something isn't right and seek help quickly. Trust your instincts and don't hesitate to consult a medical professional. By learning about meningitis, you're already taking a big step toward protecting your child. You're proactively equipping yourself with the knowledge you need. Let's keep building your confidence by learning what causes this condition and how to spot it. We'll explore the common causes and the telltale signs to watch out for. You are your child's best advocate. Being informed makes you even stronger. Your knowledge empowers you to make the best decisions for your child's health. Meningitis isn't caused by just one thing. The main types are viral and bacterial. Viral meningitis is more common and usually less severe. Most children recover fully, but it still needs a doctor's care. Bacterial meningitis is a medical emergency. It can be life-threatening and needs immediate treatment with antibiotics. There's also a rare fungal type, mostly affecting those with weakened immune systems. Viruses and bacteria that cause meningitis spread like colds, through coughing, sneezing, or close contact. Good hygiene is key, especially in places like schools and daycares. Just being exposed doesn't mean your child will get sick. The illness happens when germs reach the meninges. Your pediatrician will focus on the most likely causes and guide you through next steps. Recognizing meningitis symptoms quickly is absolutely vital. Meningitis is a serious infection, and early detection can significantly improve the outcome. Early detection is crucial. Prompt medical intervention can be life-saving. In older children and teens, be especially vigilant and look for a sudden high fever, which is often one of the first signs. Also look for a severe headache, one that is far worse than a typical headache. A stiff neck, making it difficult to move their head, is another key indicator. Sensitivity to light, where bright lights become unbearable, is also a common symptom. Vomiting, especially when it's persistent and not related to other illnesses, confusion, or any noticeable change in mental state, should raise concern. Or a rash, which can appear as small pinprick spots. They may not be able to touch their chin to their chest due to the stiffness in their neck, or may avoid bright lights, seeking refuge in dimly lit spaces. In babies and toddlers, symptoms are often more subtle and harder to spot, requiring careful observation. Look for a high or even a low temperature, as both can be signs of infection. Unusual crying, a cry that sounds different or more distressed than usual. Irritability, being unusually fussy or difficult to console. Refusal to feed, showing no interest in eating or drinking. Vomiting, even without other obvious signs of illness. Limpness, or a floppy, unresponsive posture. Or a bulging soft spot on the head, which is a clear indication of increased pressure inside the skull. The classic meningitis rash, often associated with the infection. Small red or purple spots that don't fade when pressed. A simple test you can do with a glass. Signals a medical emergency and requires immediate attention, but it doesn't always appear, so don't rely solely on the presence of a rash. Trust your instincts. You know your child better than anyone else. If your child seems much sicker than usual, exhibiting a combination of these symptoms, or is getting worse quickly, don't hesitate. Seek help immediately. Even if not all symptoms are present, a rapid decline in their condition is a red flag that warrants immediate action. Don't wait. Getting checked by a doctor is always the safest choice, providing peace of mind and potentially life-saving intervention. Your awareness of these symptoms and quick action can make all the difference in your child's health and recovery. Remember, you know your child best, and your observations are invaluable. When in doubt, act fast and consult a medical professional. If you're worried about meningitis, it's crucial to act swiftly. Early detection can make a significant difference in the outcome. Here are some quick checks you can do at home to assess the situation, providing valuable information as you prepare to seek medical attention. These checks are not a substitute for professional medical advice, but they can help you gather important clues. It's essential to perform these checks while simultaneously seeking medical help from a qualified healthcare provider. Time is of the essence when dealing with potential meningitis cases. For the rash, which is a common symptom, perform the glass test. Press a clear glass firmly against the spot in question. If the rash doesn't fade under the pressure of the glass, call for emergency medical help immediately. This could indicate a serious issue. Ask older children if they are able to gently touch their chin to their chest. Observe their range of motion and any signs of discomfort. If this movement is painful or completely impossible for them to perform, that's a significant warning sign that requires immediate medical evaluation. For babies who cannot communicate as clearly, gently try to move their head from side to side, observing their reaction. If they resist the movement, become distressed, or cry out in pain, be concerned. However, it's crucial to never force the movement, as this could cause further injury. Carefully notice if your child is consistently avoiding looking down, as this could indicate stiffness or pain in their neck. Pay attention if they are reluctant or unable to engage in activities like playing with toys on their lap, which requires them to look down. Watch closely for any signs of sensitivity to light, which is another common symptom of meningitis. This sensitivity may manifest as squinting, excessive crying in bright environments, or actively seeking darkness and avoiding well-lit areas. Carefully check if your child is exhibiting signs of being unusually drowsy or lethargic, more so than their typical behavior. Look for signs of confusion, disorientation, or difficulty waking them up from sleep, even with gentle prompting. Be aware that a child experiencing meningitis may exhibit a strong aversion to being touched or held, even by their parents or caregivers. It's important to combine these objective checks with your own gut feeling and parental intuition. Trust your instincts. Ultimately, if you're worried about the possibility of meningitis, don't hesitate to act quickly and seek immediate medical attention. If you suspect meningitis or your child is very ill, act immediately. Don't wait. Go straight to the nearest emergency room. Time is critical, especially for bacterial meningitis. If your child is unconscious, having a seizure, or struggling to breathe, call an ambulance. When you call, clearly state you suspect meningitis and describe the most serious symptoms. At the hospital, tell the medical team what you've observed and any checks you did at home. Give details about when symptoms started and how quickly they've progressed. Your clear communication helps doctors act fast. You are your child's voice. Be confident and direct. Quick action and information can save your child's life. Trust your instincts and don't delay. Feeling scared is normal, but channel that energy into action. Being prepared, knowing symptoms and your plan, helps you stay calm. In an emergency, take a deep breath and focus on the next step, getting help. Keep a small hospital go bag ready with essentials like a phone charger, medication list, and a comfort item for your child. Preparation reduces stress and lets you focus on your child. Remember, acting despite fear is what makes you a strong parent. Trust yourself and the medical team. Once your child is in professional care, you've done your part. Lean on support from family, friends, and healthcare providers. You're not alone. Prevention is powerful. Vaccines protect against the most dangerous types of bacterial meningitis. Keep your child's immunizations up to date, including Hib, pneumococcal, and meningococcal vaccines. The MenXY and MenB vaccines are especially important for preteens, teens, and college students. Ask your pediatrician about the right schedule for your child. Good hygiene, hand washing, covering coughs, and not sharing drinks also helps prevent meningitis. Share this knowledge with other parents and caregivers to expand your child's safety net. Awareness, vaccination, and healthy habits are your best defense. By staying informed and prepared, you're doing everything possible to keep your child safe.